So the classical, let's say, toxicity endpoints are graft versus host, graft rejection, uh, viral reactivations, but maybe in less recognized serious life-threatening complication is autoimmune cytopenias. My lab has done some research on this, mainly because we were facing with optimizing the transplant platforms, we were recognizing that autoimmune cytopenias was occurring more frequent. Maybe because the survival is better, and we did a predictor analysis. And what we found, less interestingly, and this was in a cohort of over 380 patients, that the incidence of autoimmune cytopenia, yes, it's less than GVHD, but it was only a little less than 10% of the transplanted patients. And when you zoom in on these autoimmune cytopenia cases, we found that predictors were being chemo-naive. So the patients who were transplanted for non-malignant indications were more, the, let's say, probability to develop an autoimmune cytopenia was higher. All the predictors for autoimmune cytopenias were GVHD and viral reactivation. And of course, if you use ATG in the old-fashioned way, you can face more viral reactivation. So also ATG was found to be a predictor. So in summary, autoimmune cytopenias can be a serious and life-threatening complication after transplant. And interestingly, the non-malignant patients who were chemo-naive, so having a normal immune system before transplant, were more likely to develop an autoimmune cytopenia, as well as patients who were facing an GVHD or a viral reactivation, because in these settings, the immune system is activated, at least that's our hypothesis, and maybe a little bit, so the balance in immune reconstitution may be disturbed by these immune events. In summary, again, autoimmune cytopenias can be triggered by being chemo-naive, immune inflammatory events like infection and GVHD. And hopefully by recognizing that in the early phase, or considering strategies, preventive strategies, for instance, by adding rituximab to the conditioning regimen, we can make transplants safer by preventing these, let's say, potentially life-threatening events.